My name is Pmi. I'm a maternal and reproductive health specialist with experience in managing and implementing community-based intervention that support maternal health and menstrual hygiene management in rural Nigeria. I am the founder of Pmi Medical Initiative, which focuses on ending maternal mortality and period poverty among underserved young women and girls of reproductive age. I am the 2020 winner of Commonwealth Point of Light Award by Her Majesty the Queen. I am the winner of Ingenuity Fund, supported by Gates Institute and Bayer. I am the winner of 120 on the 40 Family Planning Champion. I am working with more than 45 volunteers and 95% of which are medical personnel. What inspired me? Barely 4 days after I gave birth to my daughter, I was rushed back to the hospital with diagnosis of Pmi sepsis, and then the battle to save my life started. After I recovered and went home, my thoughts were only filled with the uncountable underserved pregnant mothers in the rural communities which I had met at the course of my work. I thought that if I could have all the modern services available to me during delivery and still came down with Pmi sepsis, which is one of the leading causes of maternal death in rural Nigeria, what then becomes the fate of these women who depend solely on traditional birth attendants during child delivery? At that moment, I became very determined to do everything within my possible means to save the lives of these young women and mothers in rural communities. This is what we are doing. Our evidence-based intervention in maternal health care is providing underserved pregnant mothers with access to focused antenatal care services, which includes ultrasound scanning, tetanus toxoid immunization, intermittent preventive treatment for malaria in pregnancy, identification and management of pre- and post-eclampsia, HIV and AIDS and syphilis, access to clean and safe child birth, and access to skilled birth attendants, including introduction to family planning commodities and services. Also, we are ending period poverty by creating access to innovative, durable, and hygienic means of managing menstruation through the distribution of menstrual cups. This project has ensured dignity and privacy for countless young women and girls of reproductive age who lack access to hygienic means of managing their menstruation as a result of severe poverty in the rural communities. So we are assessing menstrual cups and distributing with quarterly menstrual hygiene education and instructions, including the correct use, maintenance, and disposal of these menstrual cups. How is our work disruptive? Our baseline survey indicated that due to extreme poverty, only 18% of young women and girls in reproductive age in rural Nigeria uses sanitary pads, which is mainly donated. This is not sustainable as seen by the effect of COVID-19 outbreak. As an alternative, they are forced to use improvised materials such as dirty rags or leaves, a bucket of sand or ashes, or dug holes in the ground, or transactional sex to pay for pads. Not only are these methods uncomfortable, but it can lead to leaks, movement restrictions, stigmatization, severe infections, and STIs. Our menstrual cup innovation is improving the ability to maintain hygiene and health, reducing 90% of more plastic waste from period products, and motivating them to become champions that destigmatizes menstruation. Our impact so far, we have reached more than 28,000 pregnant mothers with our maternal health care services. We've reached 51,000 women and men with our family planning commodities and services. We have reached 3,000 young women and girls with menstrual cups and menstrual hygiene education. We have reached 5,400 local birth attendants. We have trained them on maternal and reproductive health services and encouraged health facility visits for pregnant mothers in rural Nigeria. How do we plan to scale up? We are looking forward to becoming manufacturers of menstrual cups instead of purchasing or depending on donations alone. This will enable us to reach a greater number of our target population, which currently exceeds 1 million young women and girls. This award is the potential miracle in achieving our goal and improving our work. Our budget, we hope to replicate and sustain our work in more than 200 rural communities across Nigeria by refurbishing and sustaining at least 140 primary healthcare facilities in rural Nigeria. and this will be for maternal health care services, mental health care, and birth attendance training, including menstrual hygiene management. We also hope to become menstrual cup manufacturers and reach more than 400,000 displayed young women and girls with menstrual cups and menstrual hygiene education. Our budget is approximated to $90,000 US. Thank you.